I'm Brandon Staglin, and this is One Mind Brainwaves. When I was diagnosed with schizophrenia when I was 18 years old, not only was it a very terrifying experience due to the symptoms, but it also was excruciating to have to go through about 6 months of trial and error, trying different medications, trying to find one that might help me manage my symptoms and go back to a functional life again, go back to school, be with my friends again, enjoy being with them again. And the despair and anxiety and uncertainty of that 6 months of trial and error was almost too much to bear. I nearly ended my life because I just didn't know if there'd be any future for me, trying this medication, that medication, dealing with the side effects. It was just hell in and of itself. So this is something that pretty much everyone who develops a serious mental illness goes through. Millions of people around the world, when they are diagnosed with a serious mental illness, go through a trial and error process of different treatments, different medications, because up till now, there has been no easy way to tell what treatment might be the right one for the right person at the right time. What if it didn't have to be that way? Joining us today is someone who's on a mission to change all of that. His company, Alto Neuroscience, is using patients' own biology to develop more targeted and effective drug treatments for a variety of brain health conditions. Technology is redefining psychiatry. We'll also talk with someone who knows what it's like to live with a lifelong depression. He's also on a mission to share his story and encourage others to share theirs. Stick around. Later, we'll hear from our team at One Mind Cyber Guide about their mental health app pick of the week, an app that helps you to manage your moods using a series of daily tools and strategies. And we'll also have a special performance by a true champion. But first, here now to discuss his innovative and groundbreaking work in precision psychiatry, Dr. Amit Etkin. He's the founder and CEO of Alto Neuroscience. He's also a professor at Stanford University. Amit, welcome to Brainwaves.
Thank you. It's a pleasure to be here with you.
Likewise, it's great to see you again. Thanks for being with us today. So viewers, remember, you can post comments or questions in the chat section of this webcast at any time. And if you find that you're benefiting from, you think someone you know can benefit from the information we're sharing today, please share our webcast with them. So Amit, you founded Alto Neuroscience not long ago in 2019. How does Alto leverage your research findings from your academic career to build translational benefits for patients, actual people living with brain health challenges through the biotech industry?
As you mentioned, I've been at Stanford on the faculty since 2010, over a decade, and recently left Stanford to found Alto because essentially the opportunity was such that all of the knowledge we've built in the lab on a couple of core questions could now be leveraged to drive the development of new drugs, which should really only be done in biotech, can't really be done in the lab, to get them out into the world. And the core questions we'd focus on in the lab are the ones that I think are holding back psychiatry and holding back new drug development for the brain, which is namely how to get past diagnoses, which are made clinically right now, which don't inform us as to what's really going on in the brain, how to develop drugs or how to deploy them, and get to the biology of the individual patient. So basically, can we come up with tests that tell us about the biology of the patient, that categorize them in ways informative for treatment outcome and for giving them the right drug, but which are separate of their diagnosis? You think of this as analogous to if you come in with chest pain or difficulty breathing and your diagnosis is having heart failure. We don't stop there. We characterize the cause of it in order to be able to get you the right treatment. That's what we've been working on in the lab, is understanding that level of individual biology. What are the right tools? What are the right kinds of approaches analytically? And now that we have our handle on that, a decade of work, right? Now we can use that to design new therapeutics around that individualization approach.
Wow, that's so innovative. That's phenomenal. I'm really impressed. How is Alto's scientific approach different in this respect from other companies working in biotech?
So, we take seriously the learnings that have happened over the past 1 to 2 decades which are as follows. So first of all, we know that because we don't really understand the human disorders as well as we ought to, and that's where our biology and our biomarkers are focused, that we should do our development work in humans. We know preclinical or animal models just haven't translated into effective therapeutics. So let's stop doing that. Let's do all of our work in humans and then rethink how is it that we're going to get human data to inform this question of developing the right drugs for the right patients. And so at every stage in the process, be it early on or later, we use biomarkers to tell us about essentially two things. One is, what does a drug do to the brain? And the second is, for whom is that the right thing to do? So what does it do to the brain seems like a question we ought to have been asking historically and frankly across biotech now, but mostly is not asked. Mostly, as it turns out, when people develop a drug, they get an idea early on, and they kind of have a linear path towards a target that may be hard to sway based on data as it's coming in. It's like a trajectory that you follow. Our view is that we ought to be learning from every stage in our clinical trials, what is that drug doing, and in whom is that the right thing to do? So as we do early stage work in healthy people to understand that drug effect, or larger scale clinical trials, it's all about drawing those lines between stages, between drugs and their mechanisms, between disorders, between different options, different types of drugs for the same disorders, and getting that insight. That's what I think makes Alto quite unique.
That really is unique. You got your eyes wide open at each stage of the testing process and the actual prescription process. Trying to assign the right drug to the right patient instead of going blindly ahead toward an outcome which is just far in the future. This is a great way to do this. How does AI figure into this? Is that part of the process and of identifying biomarkers? And how do you match the right medications to the right patients using these biomarkers? And how is the process, what does that entail?
Yeah, so let's even first define what we mean by biomarkers, because everybody has their different definitions. For a brain disorder, the most relevant biomarkers, I think, are those that tell you directly about the organ. So measuring brain activity, for example, with EEG or electroencephalography, often called brainwave recordings, measuring the output of different brain circuits through behavioral tests by monitoring sleep and activity patterns, and then measure the essentially genetic correlates of it by looking at people's individual genetics. But for the most part, we focus on those first three biomarkers: EEG, behavior, and wearable data. And then AI is one way to put that together, especially when there's a lot of variables you're looking at. But I often kind of joke around internally that by AI, we mean both artificial intelligence and actual intelligence, that we know a lot already about the brain, and we're striving for simplicity. So a good biomarker might be an EEG pattern. It might be the reaction time on a test. It may be how much you sleep or what the structure of your sleep is. Or it could be a combination of those. And as it gets more complex, we need more artificial intelligence, AI algorithms to put them together. But we should always strive to understand why it is that these different things are predicting, so that we're not picking up random signals. We're actually characterizing people and a coherent biology of individual patients, and never let go of that fact. We have to be able to make progress by understanding as opposed to just kind of empirically doing.
Yeah, that's fantastic. Making knowledge out of data that's actually directly helpful for people. That's wonderful.
Okay.
Would you say that the AI component of what you do is it a game changer for neuroscience research and development?
Yeah, so I think the AI definitely is a big part of bending the curve. I think there's essentially two important things to consider for AI. One is the algorithms themselves, and we've done a lot of innovation on that, developing novel methods, for example, for decoding EEG, but also the data you bring in. And the data is perhaps the most important component. The data for us is often the hardest to get data, which is where you biologically deeply characterize a person and done it longitudinally, so repeated over time, and have repeated clinical assessments over time, because they're also getting an intervention. That inherently makes the biology clinically meaningful because it's tied to a measurable face valid clinical outcome in the course of what treatment looks like. And that's how we've discovered a lot of our biomarkers. And that's exactly the context in which we embed biomarkers and AI in our clinical trials. So we run trials with large samples of patients across different diagnoses, because we know the brain is going to tell us more than the diagnosis is going to tell us, and then try to fit those models based on that rich data to predict who will respond. And then that becomes the population that we do the final development, the phase 3 and approval around, is a population defined by a biomarker within a diagnosis.
I get it. So the puzzle pieces all fit together to actually get you down to that phase 3, using the biomarkers, the clinical outcomes, how they correlate, and then you can see what patients to test the medication on, see if it's the right, so it's an enriched population, so you have the best chance of success for the actual trial.
That's right. One of the things that we've really seen in spades as we've traveled around the space is historically, all of our drug trials in psychiatry were set up maybe inadvertently, such that they actually don't learn from either successes or failures why it worked. And that leaves you with a very empirical approach, which might be okay to create treatments, but it's not really an effective way to change reality, which we desperately need. Speaking as a clinician, for the world, in terms of people suffering from mental illnesses, family members, we need to rethink our process. And so the way we use biomarkers, the way we use AI, the way we structure our studies, all the pipeline of drugs that we have, it's to be able to actually learn so that we can move forward more efficiently. And the next generation of biomarkers and drugs is more effective, more targeted, and developed faster.
Brilliant, beautiful. It sounds like you did mention that the suffering of people who struggle with these conditions is a motivator. What was your personal motivation for founding Alto Neuroscience? Was this part of your original vision when you were working at Stanford? And how is this part of your long-term vision?
Yeah, so despite living in Silicon Valley for all of these years, and having neighbors who started companies, for example, it wasn't actually something I thought about until relatively recently. And what really made me think about it and then realize not only did I need to start a company, but I needed to leave academia to actually lead it, is that though things had been going beautifully well at Stanford, a great academic career, no complaints on that front, we could just never get big enough and go fast enough to make findings definitive and to move the needle clinically. So findings were slow to come because it's just a slow process with NIH grants and running studies. The sample sizes were not what they need to be to really be definitive, but ultimately to create a new treatment, which has always been my motivation. You need to be able to do it in a different way, and that different way is industry writ large, startups or big companies, because you just can't do it. You just can't do it in academia. Now, I've always held the view that my goal for my research is to be able to do things in a different way to impact as many lives as possible. So the goal of research is to unlock that, right? To give you the ideas and the path forward so that you can implement and really do it at scale in a way that nobody had benefited before. That would be incredibly satisfying to me personally, but that's been the mission, and the company is just one step along that mission.
Okay. Well, it sounds like you have an even broader vision beyond Alto, but that right now this is your main focus. I can't wait to see how this is an important part of reaching many, many people with new medications and new treatments that will help them. So psychiatry, as we mentioned, typically has operated with a trial and error approach, like I was talking about at the beginning. And the testing and approval process itself can take many, beyond a decade when you have a new compound trying to get it ready for use and approved for use in actual patients. What do you see as the biggest hurdle in translating neuroscience discoveries to actually reach patients and benefit them? And how does Alto solve for this? We've gone over this a bit, but would you like to elaborate?
Yeah, absolutely. So there's a few hurdles, and we're trying to solve a number of them. So one of them is obviously to define the people who should get the drug, because they should experience a much bigger effect of the drug, which means your studies could be smaller, faster, more targeted, and frankly, less about guesswork in the trial and more about execution to an outcome that makes sense, that comes out of the work, right? On the one hand. But the other barriers, and one that is a unique opportunity in drug development for the brain that you don't see in other areas, is that there's actually a lot of drugs that have been created over the past 10 or 20 years that have never made it through because of these same core questions. Don't know the population, don't even know the indication. Take a random stab at it, it works or doesn't work. You don't know why, you don't really extract the learnings, the drug is shelved. And traditionally, pharma has had a very specific view of even the intellectual property that's needed to protect a drug to be able to get it to market. So the obstacle, in a sense, is thinking, ironically, that the brain is so complicated we need a brand new science. There's actually a thinking barrier here. Of course, the brain is complicated. It goes without saying, but it doesn't mean we can't do simple things to move it forward and leverage all of that work across pharma for decades, creating drugs that we know are safe in humans, that move the needle biologically in some way, and we just need to figure out how to properly use them. There's this term repurposing that's sometimes used. I question the original purpose. We are purposing, taking all of that, standing on the shoulders of giants, all of the work that's been done. Now it's a final mile problem. And I think we've got to get our mindset into a final mile problem rather than a boil the ocean approach where you're just trying to come up with brand new molecules, brand new science that will take years, decades maybe to make it into patients. The solution may be much closer at hand and may be much simpler.
And with these biomarkers, you have a way to track how to go that final mile. It's not blindly seeking random directions. You know where you're going, you know how to get there. You can make that final mile, make progress across that mile and reach the end. Fantastic.
That's right.
Yeah. OneMind invests in innovative companies through our Catalyst Fund that have a chance to make a real difference in the lives of people who live with brain health struggles. And we're very proud of Alto Neuroscience as one of our first investments through our Catalyst Fund. How hard is it to secure funding for early stage neuroscience projects? And how does that compare to for securing funding for other health conditions like cancer, heart disease, or diabetes?
Yeah, and it's always been much harder to get funding for neuroscience projects, and even more so when that neuroscience is related to psychiatry. I think psychiatry has been very long neglected. I think if you look at it just recently, really over the period of COVID, there's been obviously much more investment. People are talking about mental health left and right, but it's still nothing like an oncology company. The feeling of investors that there's a lot of risk. Well, yeah, there's a lot of risk if you think about things traditionally, but so many startups are trying to rethink that process of characterizing people, developing drugs, developing non-drug interventions, and that's exactly where Alto sits. I think we have to shift our framing to the opportunity, so the benefit, not the risk, because there's so much need out there, and there's so much opportunity for even small innovation to have an impact. That I think that's where a lot of the frustration of founders in the space comes from. Some of the hesitation of investors. I'd love to see that curve bend, because marketplaces are massive, opportunities clinically are massive. Wouldn't it be great if we could really seed these companies and actually energize the area so that we're not constantly feeling like we're comparing to oncology for no really good reason?
Absolutely. What does an investment like OneMind's mean for your research at Alto?
So having supportive shareholders, especially those deeply invested in advancing mental health, such as OneMind, is really for us critical. And the reason it's critical is because we see an arc that, of course, we're planning for success, but we've got to prepare for bumps in the road, basically for the opportunity to learn, which will come through what we do. And having shareholders that see that long vision because they see the need. And this is not just OneMind. We have a wonderful group of supportive investors along that vein. That's critical. Again, we're going to try to change a really big area in a really big way. And sometimes that works straight out of the box, and sometimes that doesn't. But if we're on this mission together, both the company and the funders, then we can learn and adapt and make sure we do hit our target without depending on it being the first shot that hits the target.
Hmm. Yeah, as I said, we're proud to have helped you along your way getting started.
It's been a
So,
pleasure.
great. So you started by focusing on major depressive disorder and post-traumatic stress as the diagnoses of interest for the drugs you're creating. Um, but your biomarker platform is designed to scale broadly to many different brain health challenges. What is your vision for the future? Who do you envision benefiting the most from Alto's technologies and new therapies?
Yeah, gosh, I hope that a lot of people will benefit to a great degree. And while you're exactly right, while we're starting with depression and with PTSD, and that's strategic, we see the opportunities as much larger. So, for example, addiction and bipolar depression, bipolar disorder are adjacencies, right? But even if you think of the domains of mental functioning that we target with our pipeline, which are cognition, emotion, and sleep, those cover things relevant not only to the range of psychiatric disorders and the range of ages, by the way, and developmental disorders, disorders of aging, and so forth, but also aspects of neurological disorders. Cognitive impairment drives a lot of disability, for example, whether you're talking about depression, and depression, by the way, is itself the leading cause of disability in the world, schizophrenia, autism, Parkinson's disease, multiple sclerosis, let alone things like Alzheimer's. If you have a biomarker that tells you for whom that drug is effective, the opportunity to now be effective clinically in that population of people across disorders is massive. And that's really what we're trying to do, exactly as you said, is scale the platform and the drug. So it's not one indication per drug. It's a type of person that's present in different prevalence, different numbers of people relative to the population in different disorders, all of which could be helped.
Absolutely. It's a whole new paradigm of looking at it. It's not like if you have bipolar, you get this drug. If you have depression, you get this drug. It's if you have this biomarker, this physical characteristic within your biology, then this drug is likely to help you. And maybe you have one diagnosis or another, but you have this biomarker. You know you're a good candidate to benefit from that drug. That's fantastic.
Exactly. And you know, we're not alone in this, in a sense, which is that oncology has now moved to that model of saying you may have a particular mutation in a lung cancer, particular mutation, that same mutation, and a cancer in your liver or your colon, but it's still the same mutation that responds to the same treatment. I think that's a great way to look at psychiatry just as much.
Seems like the world is going in this direction, and you're one of the leaders. Fantastic. So you are in the growth stage right now at Alto Neuroscience. How can interested people get involved? Are you hiring right now, and what sort of qualifications are you looking for?
Yeah, so we're looking for at base smart and motivated people. We'll always be able to make use of smart and motivated people because this is a set of opportunities, things going on that are more than what we can even do just in our normal course. And keeping our eyes open and making sure the people we bring in keep their eyes open is critical. We're looking for folks on the data science side to drive analytics. We're looking for folks on the clinical operations side to drive our clinical trials. If you go to our website, you hit join us, there's a list of available jobs, or you can email us at info@altoneuroscience.com. Always looking to hear from motivated people, people who truly want to change the outcome of mental health conditions and change them now. That for us is such a key part of this, is people who feel the urgency that we feel that we need to change reality on the ground as soon as possible.
Absolutely. That's a clarion call for more people to join this cause. Thank you,
Absolutely.
Amit, for all that you're doing, and I hope you get lots of momentum with people joining in. And thank you for being with us on Brainwaves today. Can't wait to see what your company does.
It's been my great pleasure and look forward to continuing the conversation.
He's a former comedian who now runs Fresh Ground Stories, Seattle's longest running storytelling open mic event. Part of his personal therapy is storytelling of his own about his personal experience surviving depression. Paul Currington, welcome to Brainwaves.
Thank you for having me, Brandon. It's great to be here.
Great to have you. Great to see you again. We were both members of the Stability Network, and that's how I initially met you a few years ago. Great to reunite with you today. Hope you've been well.
I have been, surprisingly. I mean, ups and downs, but I'm still here. I'm making it. And doing stuff like this is a big part of making it for me anyway.
Thank you very much for being with us today. And yeah, I know what you mean about ups and downs. And also thank you for being a principal person in our documentary soon to be released on major depressive disorder, Reaching the Light. How was that experience for you, being featured in that film, telling your story?
I got to say, even though we were talking about depression and suicide, that was one of the best days I've had during COVID. Maybe the best day. It just for one day, life seemed normal. I had people at my house. We were all wearing masks, so that was weird. But we were just talking and having fun and telling stories, and everything was just normal, just for that moment. It was really one of the best days I've had during COVID.
That's great to hear. Glad you had such a good experience. And I know what you mean. The rare moments I've had to get together with people since COVID started have been really refreshing. And great you could do that in that context as well. And look forward to sharing that documentary with the world and sharing your story with the world that way. Yeah. So
it was so I was so touched just to be asked. That meant a lot. So thank you for that.
Your story is very meaningful and powerful and interesting. And I hope you'll share a bit of that with us today. Let's get started with the questions and we'll roll into that, okay?
Yeah, let's go.
Okay, let's do it. Major depressive disorder, your diagnosis, is common, affecting over 17 million adults in the United States alone. But each person's story who experiences this is unique. When did you first start experiencing depression? And how is it manifested throughout your life?
I don't think I was diagnosed till maybe 15 years ago. But I looking back, I know I've had it since I was a kid. My house was so chaotic. My mother was very dramatic. My dad was very silent. So there was this tension, a lot of just so much chaos and so much tension. And there was just not a moment of peace. I was one of those kids. I was just kind of scared to go home from school because I never knew what was going to happen. And I didn't know then that a lot of those times when I was sitting in my bedroom going, what's wrong with me or what's wrong with the world would now be called depression. But when I was 17, years after my parents had split up, my mom died. So I was kind of just floated from then on. I just sort of survived. I couch surfed through my last year of high school. And I just sort of had to take care of myself, not understanding that most of those next 20 years were just dealing with really kind of low level, but constant depression of ups and downs, of course. But it wasn't until I found a good therapist, many years later that I scored really high on that test. I got A+ on the depression test. So, top of the class, you might say.
Competing for the depression score.
Right. I no scholarships, but I feel I did well.
Okay, so you've experienced depression throughout your life, and very acute when you first saw that first therapist. But you're now doing amazing things with advocacy, and apparently you've found ways to manage it. What was the turning point? How are you able to move to a more stable place of, instead of being consumed by your depression, to a place of managing it, even thriving with it?
Well, in 2012, December of 2012, I went through a really painful breakup. Obviously, I was the one who got dumped, and it was someone who I'd been together with for years, and I wanted to marry her and spend my life, and then she left, and I had a suicide attempt. And it was so shocking to me that I would get to that point. And I still remember those feelings. It was as though I was doing everyone a failure. And when I woke up the next day, luckily in my house and not a hospital, I realized, man, I got to take this seriously. And so I gave myself a year to do everything I could to deal with my depression, because suicide is not it's not a healthy way to deal with a breakup. It's not the recommended protocol. And I thought, if this can happen to me, it can happen to me over and over again. So I wanted to go down swinging. So I got 2 therapists, and I did all kinds of other stuff, and everything anyone told me to do, I did, because I wanted to give it my best shot. And all the things I've learned since then are what keep me alive now. And what I dealt with before that moment, that terrible night in 2012, was, I guess what they call in recovery, I was white knuckling it. I was just drawing on this well of willpower that finally ran dry that night, and I realized, oh, I can't do it this way anymore. So that was the real turning point when I realized I have to take this seriously, or else I'm not going to be around to take it anyway.
That is really touching and inspiring that you didn't give up at that point, and you realized that you wanted to live and you wanted to go on trying to be well and live a life that you could be meaningful for you. I really admire your tenacity and resilience in that moment of a crisis that you had. Thank you for sharing.
Yeah, it was, I guess part of it was I didn't want to embarrass myself. I wanted to tell myself I gave it my absolute best shot. And of course I have a son too, like that's another part of why I thought, this is crazy. How could I do this when I have a beautiful kid who loves me, who needs me? But that's what depression does to you. It lies to you, and you're convinced the best thing for everyone in your life is to take yourself out. And so it's I'm glad I made that choice to say, all right, I gave myself a year. I can't believe I gave myself a timeline, but I wanted to go down swinging because I'm a big boxing fan, and even though I've never boxed because I don't like getting hit, and I've never punched anyone, I love the tenacity of those fighters who are, when they're getting beat up, they don't give up. And I felt, that's how I felt, like I had Angelo Dundee or some weird guy in my corner going, not throwing in the towel. Like, you got 3 more rounds. You can do this, Currington.
And you did it.
Yeah,
you did it. You're still in the ring and still swinging.
I am. I mean, my nose is this way and one eye's lower than the other, but I'm here.
Okay. It's so glad you're here to be with us today on this webcast and share your story as you do in so many great ways. You say that the opposite of depression is connection, and I think you referenced that a moment ago when you talked about your son being a motivator for you to get well again. Your connection with your son motivated you. You spent 13 years as a comedian before transitioning to storytelling in general. How does humor help with connection? And is it hard to turn dark, sobering subjects into comedy, or is it a natural catharsis?
Well, of course, it's both. It's definitely catharsis. It sort of, for me, it comes at the beginning of dealing with pain. There's a lot more to dealing with pain and getting through pain than just humor. That's a great way to put it in perspective. For me, somewhere in my childhood, I learned how to be funny. I learned that was how I was going to make friends. And I grew up watching all the great comics, the Richard Pryors, the George Carlins, and they all make fun of pain. And so I realized kind of at an early age that if I could make fun of what was going on, if I could make my friends laugh about what was happening in my house, then I could make it through that day. Like I used to write parody songs before Weird Al was a thing, and I remember my most loved song in high school, parody song, was a parody of 50 Ways to Leave Your Lover, which I wrote as 50 Ways to Kill Your Mother, and I got such a great reaction to that in high school. I thought, this is something I can do. And so in the beginning, you can connect with people through humor. But when you start becoming a professional comic, most of your life is spent complaining. You end up connecting through things that you and the audience both hate. And that is something that I could not continue. I did it for 13 years. And there were many reasons I got out of the business. Number one is it's an incredibly lonely business. You're on the road, going to towns you've never wanted to go to, in horrible hotels. I did it before the internet, so I didn't even have a cell phone or things like that. And I just didn't want to keep connecting with people over things we hated. At the core of most jokes is, don't you hate it when this happens? And for someone like me, I don't know what makes me, if I'm different from most comics, but I don't have that. I don't thrive on that. I thrive on connection, but not the connection of shared hatred of something. And in storytelling, to me, it's really the opposite. I'm not pointing the finger out, I'm pointing the finger at me and saying, here's what I experienced, here's where I screwed up, here's where I succeeded. And the bond I have found is so much stronger with storytelling audiences, because it's all, yeah, me too, I lived through that. You're bonding over these moments where you weren't sure you were going to make it, and all of a sudden you did, and you get to share that with the audience. And that is, for me, the best kind of connection to help me through life, and also with my mental health.
That is so beautiful. Thank you for sharing how you transitioned from, the sharing about some dark things to sharing about things that really matter to you personally and that you went through. Yeah, I'm glad you've had that transition. Now you host Fresh Ground Stories. How do audiences react? And you just went through this a moment ago when you share your personal story and stories about depression, suicidal ideation in general. You say it really resonates with people. Do they share those stories with you as well? And how else do they react?
Oh, I was shocked how well every mental health story I've told and have heard others tell has been positively received. And part of that is because people who go to storytelling shows, they're there, they really are there to support people. They really do want to hear your story. And I'm talking about personal stories, not like myths or things like that. Those are great stories, but it's not what my show is about. And so I think what surprises people, both the teller and the audience, is that you can go to some incredibly dark places and people will be there for you, because by the time you get, at least for the people I coach, by the time you get to the stage, you've crafted this thing and you're through it. I always tell the people I coach on storytelling, I steal a line from a preacher, Nadia Bolz-Weber. I say, speak from your scars, not your wounds. And I feel it's not okay to turn the audience into your therapist, and don't make them feel sorry for you or that they have to take care of you after the show. So when I'm coaching someone, I make sure that they've been through this traumatic event, and what they're sharing is a story of recovery and hope. And so if they're not there yet, like I won't put them on stage, because I've been in shows where half the audience has been traumatized by what a storyteller is saying, because they're not through it yet. They're still in the middle of that horror show. And while it may be sort of cathartic for the teller, I don't want anyone to leave my show traumatized or feeling sorry for me or feeling like they need to call me after the show and ask if I'm okay. So the stories that I share and the stories that I help other people share, we're through it, and they're stories of hope and recovery. And I hope that what people get out of those particular stories, like my show, you get all kinds of stories, and not just mental health. But I want people to know that, to see someone who's been through some really hard stuff and they went on to live a good life. And not that you're ever really over something like that, but it's incredibly inspiring, some of the stories I see, and hilarious too. Some of the most painful things are hysterical, and people love it when you can get them laughing about depression and suicide and bipolar stuff, because you shouldn't be laughing at it. But if you lived through it and you can see the absurdity, it's really funny. And that part is super cathartic.
That's so amazing. Wow.
Yeah.
That's amazing. I want to see one of your shows. Are they webcast at all, or are they just all live?
Yes. Well, until pre-pandemic, we were all at our little coffee shop up there on Capitol Hill in Seattle. We've been doing it for 11 years. And now, of course, during the pandemic, we had to go to Zoom, but we will be back. And I think once we are back on stage, I am going to try to, what do you call it? Zoomcast it, telecast it? I don't know these terms. So
Live
people
stream.
can see it. Right now that we're on Zoom, I love that people all over the world are telling stories. We've had stories from India, from Germany, Australia, the East Coast. That's the only good thing about Zoom. So yes, you can tune in and tell a story or just listen now. And when we go back on stage, I'll be simulcasting it. What is that term from the 70s? that even exist
Yeah.
anymore? Simulcast?
With the quadraphonic sound
Yeah,
from the
with the
70s. Yeah.
quadraphonic.
Okay.
Exactly.
Okay.
Hi-fi. It's a hi-fi sound.
Yeah, okay. Great. We'll look forward to seeing your simulcast.
Yeah.
Yeah. And though not all the stories in your show involve mental health, it's important that people do share their true stories about how they've recovered from mental health challenges. And, as you say, it's very inspiring, but, um, why else is it important for people to share stories like that? Can it do something society-wide, or what are your thoughts?
Oh, you know what I think a lot of people have learned from this show, and that it certainly wasn't why I initially got into this storytelling. I just like telling stories. It's to see someone in real life who has lived through stuff and they're not afraid to talk about it. That's been the main thing, is it's not a secret anymore. You're not ashamed of it. In fact, there's a power that you get from living through this and then having the courage to tell a room full of strangers. Because when you tell a story from the scar, not the wound, it's like while you're coming up with a story, you're kind of pulling it out of your heart. It's not in there having its way with you anymore. It's like, to me, it's kind of like when you pull an old rusty nail out of a board with the claw part of a hammer. It's like you're pulling that story out of you, and then it's a thing. It's a piece of art, and then I decide how it ends, and I decide what it means. And so I'm not in the throes of it anymore. I'm poking that pain in its chest, saying, "Hey, you're not so tough. You're not so tough, pal. I got your number. I'm in charge now." And so that is, and people sense that. They see someone sharing this thing they went through, and it's not always traumatic. Sometimes it's just a regular story, but they see someone doing this, and they see that person is okay.
Uh-huh.
You're not weak for talking about your failures and your foibles. You're actually very strong.
Yeah.
Because it takes a lot of courage to get on, not just to do this public speaking, but to get on stage and go, yeah, I made some mistakes, or this happened to me, and I made it. It's so, especially in person. In the Starbucks we're at, they stay open an hour later so that people after the show can mingle. And that's really the best parts, where you can talk to the person, because there's no stage. It's like the person sitting next to you at a table could be standing up and telling the next story. And people love that they can just talk to that person about their experience. And so not only is it good for the teller and the audience, but it brings, it's like a little community now. And people suddenly are not afraid to share some of these things they've never spoken about. We have people who've told stories of things that happened 50 years ago that they haven't told anyone about. So it's bringing these people together and realizing, yeah, we all live through this stuff, man. Every single one of us.
That is such a beautiful insight. And it sounds like when you start sharing stories, other people start sharing stories, and it's like a chain reaction. It's like encouraging and empowering people to share their own stories, their own, what would have been secrets, but now they can bring it into light. Do you find that to be like a growing thing? Like maybe the community will grow with that momentum?
Oh yeah. It's, I know in America now that what I do is called personal storytelling. There's many, many different types of storytelling. What I do is personal storytelling. And I learned it from the podcast, The Moth, this NPR podcast, which is a national thing. And a friend of mine started the show that I now run back in 2010, kind of partnered with The Moth. And then I sort of took over hosting and took over the show when she left. And there are many shows around the country, just like mine, where people get up and do this. And I wish I'd known this growing up. When I was growing up, I knew I had something to say, but all I saw was Johnny Carson. And so it was either stand-up or acting. So I went with stand-up. That's all I could. So I had no idea that people told these kinds of stories. So I always encourage people, if you want to start your own show, or just people now who've been to Fresh Found Stories, host storytelling nights at their homes. We just have half a dozen people come over for a potluck, and they go, hey, the theme of the night is the kindness of strangers. Come tell a story about, a personal story that happened to you on, some theme. And people are stunned. They've never heard it either. They didn't realize this is a thing you could do. And so slowly, I think it's really growing.
Yeah, that's amazing. What a great idea. What a great movement that you are an intrinsic part of moving forward. And you just light up when you talk about this. How does hearing others share their stories, perhaps as a result of you initiating the process, but how does hearing others share their stories help and inspire you in your ongoing pursuit of wellness?
Well, it's two things. I've been thinking about that recently because for some reason recently I've heard some really powerful stories. And the first thing that hits me is that I'm not alone. Like people have, no matter how many years I've been doing this, there's still days that I think, I'm alone in this world. No one has lived the life that I have, blah, blah, blah. But there are people out there who will tell a story that make me realize, man, I gotta up my game. There's still some things that I can talk about in my life that I'm scared to, that I'm still maybe ashamed of a little bit. And I just saw so-and-so tell a story about something that I've been afraid to talk about. And that is huge for me. So I'm always surprised by these stories. And when I see people with this much vulnerability and this much humility get on stage, it's always inspiring. It always shows me that I can go deeper, I can go further, I can work harder, and that it just reminds me that I'm surrounded by people who have this in them that I'm not aware of. I walk by them every day. So it makes me feel less alone, and it makes me excited to dig deeper and to write even better, more personal, more vulnerable stories.
Gosh, that's beautiful. And just to see the depth of the human spirit, through your comrades, your fellow storytellers, and to be, inspired to, have that growth mindset. You can grow in new ways that you hadn't thought of before. I mean, that's just must be so liberating feeling.
Yeah. And you don't need to find a documentary on Netflix. Like, these are just regular people. And none of these are actors or comedians. I never tell my comedian friends about this because I don't want them telling a bunch of jokes. Like, these are bus drivers, these are plumbers, these are just regular teachers. I've heard stories from teachers. I didn't ever realize what they're dealing with in this pandemic. Like, wow. And their own mental health issues of what it's like to be a teacher. And so these are just regular people. You're not going to be blown away by Steve Martin coming out and telling a story, or Martin Short. It's like, wow, that person really is just like me, just a regular human being trying to get through life. And that, to me, that's so important. When we've had baristas on their break run around the counter, tell a story, then go back to work. Like, it's so, you never know who has some amazing story inside them.
I think that's part of the lesson that you can share, that everyone has a story and that it's worth sharing and understanding. That's beautiful. Yeah. So Paul, are you up for Brainwave tradition? The speedy lightning round?
Yeah, let's do it.
Okay.
Right.
So these are going to be 3 questions, quick answers, and love to hear what you have to say.
Okay.
So ready?
Let's go. Let's see what I come up with.
What helps you cope when you're going through a tough time mentally?
2 things: exercise and also being of service. I have to feel needed even though nobody asked. So this year during COVID, I started dropping off snacks on people's doorsteps. They didn't ask. I was the snack fairy. I just had to get it. So people came to their house and there was like piles of chips and candy on their doorstep. And I text them, snack fairy is here. I really felt like, and I feel guilty now that it was just mostly empty carbohydrates. But doing that every couple of weeks, oh my God, that really helped. So being of service, even though perhaps I was a detriment to their cholesterol and blood sugar.
but healthy for the soul.
Yeah, exactly.
That's amazing. Yeah. What a service. That's amazing. What song do you turn to when you're feeling down?
Okay, I don't have a specific song, but there are some artists I know I must avoid. Anyone like your Leonard Cohen's, L.A. Smith, Nora Jones. God bless Nora Jones. Cannot put her on when I'm sad. It's mostly songs to avoid. 70s soft rock. You should never listen to 70s soft rock when you're feeling low. I'm all out of love. I'm so lost without you. All by myself. No, bad music. So it's avoiding that music. That helps me.
Okay, all right. Now I'll remember to watch out for that stuff. Okay, thank
Yeah.
you.
No
And
yacht
then
rock.
what's that?
No yacht rock. That's what they call that.
Yeah,
I think.
okay. Yeah, I'll watch out for that. And then what gives you hope?
Two things. Other people give me hope. Seeing other people share what they've lived through, and also something a therapist shared with me years ago. I told him I was looking for something to believe in. I was looking for faith, and he said, you know, you don't find faith. You just choose to have it. And knowing that I had that choice, I can choose to have hope. I can choose to have faith. And that's really all you can do. If you look, when I look outside for some proof that I'm going to be okay, I never find it. I just have to choose faith and hope. And so that's something that gives me hope. The fact that I have a choice, and that's up to me.
That is awesome. What an insight. And it's like, knowing that if you want to have something be in the world, you can manifest it, right? It's like what Gandhi said, be the change you want to see in the world, right? So
Right.
what a great thing to remember and live by. Paul, thank you so much for being with us on Brainwaves today. Really enjoyed the conversation with you. Great to see you again. And hope to see you again very soon.
No, thank you so much, Brandon. This has been a joy for me to talk to you. I appreciate being asked.
Absolutely. Have a wonderful day.
Thanks. You too, my friend.
Now I have a special treat in store for you. This summer, One Mind put out a call for stories about what makes you stronger. We wanted to know about what life lessons you've learned through your experiences with mental health challenges. The response to our I Am a Champion contest was tremendous. We received dozens of entries, and each one who entered was a true champion with their poem, artwork, or other essay. Joining us today is one young lady who answered the call. She's a talented singer-songwriter whose entry in the contest was called Survivor's Song. Sally Liu, welcome to Brainwaves.
Hi, I'm so happy to be here. Thank you for having me.
It's wonderful to have you on the show, Sally. Thanks for joining us. Your song was really powerful and it touched everyone on our One Mind team very deeply. Tell us the story behind it. What led you to compose Survivor Song?
Well, Survivor Song is basically the story of my own struggles with mental illness because when I was 13 years old, I was diagnosed with a severe eating disorder and I was hospitalized for 5 months. And for many years afterwards, I still struggled with it. Like I was technically kind of fine and people thought that I was completely recovered because I looked fine on the outside. But on the inside, the thing was that I refused to talk openly about what has happened to me because there was just so much shame and so much guilt associated with it. And it has taken me such a long time to really learn and kind of to realize that it's not the right way to just try and erase your past and act like nothing happened. Because what I really needed to do was to really embrace my future and to go forward. And so in a way, Survivor Song is not just, a song about how I kind of regained my weight and restored my body weight and was healthy again. It is also the story about how I regained my life. And the reason why I named this Survivor Song is because these are the people that I would like to dedicate this song to. Like all the brave and strong people out there who never lose their hope, even when things get really, really tough, and who keep going on. And all the people out there who keep fighting every single day for themselves and for other people.
Sally, thanks for sharing that and sharing your experience with your mental health challenges. It's tremendous to hear that you came through that and that you're now inspiring others to share about their stories as well. Was that one of the reasons that you wrote Survivor Song, was to encourage others to share their stories too?
Yes, definitely. And that is actually also the reason why I answered your call and participated in the contest. Because I think part of the reason, or maybe even the main reason, why I was so scared for such a long time to really open up about my past is that I felt like everyone was going to judge me for it, that they would kind of see me as some weird or sick person. which I no longer was. And it is a sad fact that we still live in a society where, where there's so much stigma around anything that's mental health related. But at the same time, I also believe that we can use our voices. We can use our voices to share our lived experiences and to make others feel like they are not alone. And in doing so, I believe that we do have the power to smash the stigma around mental health, one story at a time. And that is basically why I'm here today. So I can share my story and maybe hopefully inspire others to do so too.
Thank you, Sally. It's tremendous. What would be your message to other young people who might be struggling?
I think one very important message that I also had to learn the hard way is that you are not weak when you seek help and when you try to reach out. And it's okay if you sometimes have hard times. It's like, even for recovered people or even for people who might have never really struggled with mental health issues in the first place, there's always like an up and down. And that is just something that comes with life. And it's okay if you feel bad at some days and maybe next day will be better. So you should focus on all the things that you have achieved so far and not on the failures or mistakes in the past, because every mistake is also a chance for you to learn. So please don't be afraid to reach out, to seek help if you need it, and just be proud of what you have achieved so far. I think that is something that I really, really want to, want to say to other people who are struggling right now.
Sally, you are so wise, and you're sharing this wisdom with other people. It's such a wonderful gift you're giving to your followers and to the people who are watching us today on One Mind Brainwave. So really appreciate all that you're doing for smashing stigma and sharing your story to do that and encouraging others to do that too. Thank you. Now, here's Survivor's song.
We live a life in a world full of lies, but this time I'll be honest, 'cause we need to hear the truth. The walk was hard, the climb was steep, all my scars still run so deep, but can you see them? Or do you close your eyes to me? There was a time when I was fighting alone, with no place to call home, just barely holding on. I've lost all hope, and I remember crashing to the ground with a smile on my face, said I'm alright, but I was breaking inside. Not this time, I will keep on going and running all those miles. I will keep on trying, there's no reason to hide. I will never tire, I will light a fire that breaks this ice, and I will never ever give up this fight. As long as there's hope, there is reason to survive. Don't stop, 'cause only opening our eyes can save millions of great lives. It's getting dark, it's getting cold, in a world where love is broke. Where can we turn to? We can't do this on our own. So give a hand, take a stand, make a choice and raise your voice for those who need it. You can make a difference. There was a time when I left these words unsaid, when this voice inside my head said, you're not worth it, stop, just give up. But I remember rising from the ground with tears in my eyes, said I will fight. Can you hear me screaming inside? I will keep on going and running all those miles. I will keep fire. We will light a fire to break through this ice inside, 'cause we know we won't give up this fight. As long as there's hope, we find reason in our lives. Don't stop, for we will never quit this fight till the very last light dies. We will survive. We will survive.
So Sally, where can people find other examples of your original songs related to mental health topics?
Well, if you want to hear more of my original music, you can make sure to check out my YouTube channel and my Instagram account. I go by the name of Asindita. And if you're also into poetry and you like reading short essays or just poems on things about life and nature and also mental health, then you can also visit my Instagram account at Peace of Mind Poetry. And yeah, basically, this is where I'll be sharing pieces of my mind for somebody else to find.
That's great. Okay, I want to check that out. Is it spelled peace of mind like peace, love, and joy, or peace of mind like a piece of pie?
Oh no, like a piece, like piece or slice. So piece of mind and then poetry.
Great. Oh, thank you. I'll check that out. Can't wait to see that. So Sally, thank you so much for sharing what you shared today with us. It's just so valuable. And look forward to talking with you more in the future and perhaps doing more with you for more One Mind activities. Thank you.
Thank you so much. Thank you so much. I'm so happy to be here.
Wonderful. Take care. So viewers, thank you too. Before we leave you, we're going to have a look at our One Mind Cyber Guide team's mental health app pick of the week. It's called Mood Mission. Take it away, Cyber Guide team.
Hi there. I'm Martha Neary, and I'm the project manager of One Mind Cyber Guide.
You probably already use your phone for many things throughout the day. But did you know that there are lots of apps out there to help you manage your mental health and well-being? There are thousands of mental health apps available for download today. With so many to choose from, it can be hard to separate the good from the bad. That's where One Mind Cyber Guide can help. At One Mind Cyber Guide, we review apps on 3 different metrics: credibility, user experience, and transparency. We've reviewed over 200 products, and all of these reviews are available for free on our app guide at onemindcyberguide.org.
Hi, I'm Stephen Schuler, and I'm the Executive Director of One Mind Cyber Guide. I'm a clinical psychologist and mental health service researcher, and my research focuses on the use of technology to increase access to mental health care. The work we do at One Mind Cyber Guide is important because there's a need for objective, third-party reviews of mental health apps and rigorous evaluation of their evidence base.
Mood Mission aims to help people experiencing symptoms of stress, anxiety, or depression. The app is based in cognitive behavioral therapy, or CBT, which is an evidence-based therapy. Data from the app is being used for a research study conducted by Monash University, so users are asked to complete a number of short surveys before unlocking the app on topics such as well-being and moods and emotions. The app provides different activities or missions based on how you're feeling. You select how you feel at a particular time, for example, low, depressed, anxious, or worried, and how distressing your feelings are. You then choose from a range of options which best describe the problem. Based on your responses, 5 missions are provided, each with a stated objective and an explanation of why this might help. You can choose to accept a mission and mark the mission as complete when finished. Missions can be behavior-based, for example, learning how to knit, crochet, or sew, physical-based, like push-ups, thought-based, such as self-affirmations, or emotion-based, including things like reflecting on achievements. The mission log shows all completed missions and various achievements, and additional resources are also available. Visit our app guide at onemindcyberguide.org to read our review of Mood Mission. It has received a score of 4.67 out of 5 on credibility, 3.94 out of 5 on user experience, and it also receives a score of acceptable for transparency. We also have a professional review of Mood Mission where you can read some more about the pros and cons of the app, as well as some recommendations for use.
We look forward to seeing you next week for another app review.
Thanks, Cyber Guide team. And thanks to all of our wonderful guests today, Sally Liu, Paul Currington, and Dr. Amit Etkin. Don't forget, you can check out all of our past Brainwaves episodes at onemind.org/brainwaves. We can also sign up for our e-newsletter to be apprised of all new Brainwaves episodes coming out. Thanks everyone for watching, and please have a great day.
Every day trying to find the strength. I just want things to go back to normal.
Science has collaborated to find treatments for the virus. Vaccines were developed in record time.
I don't know what to do.
But what about the mental health research needed to sustain our lives during and after the crisis? OneMind is funding the science to revolutionize treatments and provide hope. OneMind, accelerating brain health for all. Help us fund new treatments at onemind.org.